A majority of the cases are tied to nursing homes. Tonight, there are outbreaks at 56 nursing homes and 23 residential care facilities across North Carolina, including 12 in Mecklenburg County. It's a lot of numbers, but every case is, of course, someone's loved one. Our Genevieve Curtis is joining us now live. Genevieve, nursing homes will not be a part of the state's phased rollout, which is going to be tough for some families to hear.
Absolutely, Erica. It is definitely difficult. These restrictions are hard for families who have loved ones in these long-term care facilities. And today we learned those restrictions could last until the late summer, maybe even longer. So we wanted to take a deeper look to find out what that means for both the residents and their families.
Keep on waiting and time's running out.
It's been months since Tracy Smith saw his 84-year-old mom in person. She lived in Monroe Rehab and is now at Atrium Union. She is COVID positive. But even after she recovers, he's been told it could be a few more months before he can hug her again.
It's not like you get to hold her hand and tell her you love her and, you know, happy Mother's Day.
Today, North Carolina Governor Roy Cooper said long-term care facilities are not included in any of the reopen phases. Phase 3 wouldn't start until the end of June at the earliest. It still calls for strict restrictions at nursing homes and long-term care facilities, meaning families could be waiting late into the summer or longer.
We know that there is a much greater likelihood of transferring this virus in our congregate care facilities. That is why we have put an emphasis on those with restricting visitors.
I talked on the phone today to someone with a large long-term care facility that operates here in North Carolina. I'm told that families should expect tight restrictions even after the state mandate lifts. And this particular company is now working on a pilot program for visitors. But I'm told that will start with just a few homes and then expand to others. And the wait could be even longer at facilities where there's been a large outbreak. Tracy is very aware of each passing day. His mom suffers from dementia. He says time is something they don't have.
I'm hoping that she'll remember me, you know. So it's really hard to.
Yeah, you feel for all the families, all the loved ones. Another topic you looked into tonight, Genevieve, some new information you got about how things have been handled in some of these nursing homes.
Yeah, Erica, we've learned that Monroe Rehab has 66 cases, including 15 staff members, and that the health department here in Union County raised serious concerns about how the facility responded to that outbreak. Channel 9 obtained records showing public health officials raised alarms with how the facility was handling coronavirus. In an April 14th letter from the Union County Health Department to Monroe Rehab, the county wrote, quote, "The lack of adequate infection control practices observed during the site visit indicate that symptomatic residents have not been properly isolated and facility-wide testing should occur." The health department also wrote, quote, "Out of great concern is the exposed staff members are not in quarantine, therefore increasing community spread." The health department says it offered to help test the entire facility, but Monroe Rehab declined. The nursing home tells me it declined because its own lab could return results faster. And it tells me the day of the health department visit, it was in the process of moving patients to a COVID-19 unit. And Erica, I can tell you in going through those documents, the facility was also concerned about its staff and being able to care for residents because so many of its workers were getting sick. The facility tells me it moved at least 20 residents to Atrium Union for care because of that. Erica?